Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today I've got a practice question for you. This is related to the cardiovascular and pulmonary system, specifically to electrocardiograms, so EKG. This system represents somewhere between 22 and 27 questions, so certainly a very robust system on test day. Definitely worth spending your time in these big three systems, cardio, musculo, and neuro. And as I always say, it's important to study proportionately, meaning that about 75% of the test comes from these big three systems. And that means that your studies should have somewhere around 75% of the time spent in these big three systems, cardio, musculo, and neuro. And I think you would agree with me that during PT school, that was your primary focus throughout all your classes. You spent a lot of time on cardio, musculo, and neuro, with the other systems like Integ, metabolic endocrine, gastrointestinal, genitourinary, lymphatic, all of these making up a smaller part of your Npte experience. Instead, you were spending most of your time on these big three. So this is no different for today. We'll be spending some time on the cardiovascular and pulmonary system. I've got a practice question here for you. But before we get to that, just a quick reminder, if you haven't yet, be sure to leave us a like, a subscribe. Leave us a review over on Google Play, Apple iTunes, Spotify, wherever it is you're listening to this podcast. It only takes like 1 second. In fact, you could do that right now. Just wherever it is you're listening to this podcast, just go ahead and leave us a rating. It really helps in the algorithms as we try to get the word out about how to help people through the Npte. Only takes a second. I'd really appreciate it. All right, let's go and dive into our practice question for today. As per usual, I will read it to you, give you a moment to respond, and then we'll talk about it together. Here we go. A patient's electrocardiogram exhibits signs of consecutive P waves at a rate of 250 per minute, with QRS complexes appearing at a rate of 80 per minute. The baseline waves are identical and have a sawtooth appearance. Which of the following abnormal rhythms is most likely present? All right, so again, we've got a patient's electrocardiogram exhibits signs of consecutive P waves at a rate of 250 per minute, with QRS complexes appearing at a rate of 80 per minute. The baseline waves are identical and have a sawtooth appearance. Which of the following abnormal rhythms is most likely present? 1. Atrial flutter. 2. Paroxysmal atrial tachycardia. 3. Paroxysmal ventricular tachycardia. Or 4. Ventricular fibrillation. So we've got 1. Atrial flutter. 2. Paroxysmal atrial tachycardia. 3. Paroxysmal ventricular tachycardia. Or 4. Ventricular fibrillation. All right, so this question asking you about the consecutive P waves that are really humming along at 250 per minute, but the QRS complexes are only appearing at a rate of about 80 per minute, so about 1/3 the rate. That means that only 1/3 of the P waves are actually connecting with the ventricles. So you have some type of, usually we're talking about a junctional block of some kind with an extremely irritable atrial focus or pacemaker. So this is the definition of what's called atrial flutter. So atrial flutter, this is, if you see the term sawtooth, your mind should immediately conjure up atrial flutter. Those of you who are watching the YouTube version of this, I've got an image of the atrial flutter coming up here in just a sec. Those of you on the audio podcast, you'll just have to imagine this, that the atrial flutter, you have these P waves that are humming along really fast, but in a very uniform way, much like the teeth of a saw. So it has that sawtooth appearance, which has extreme uniformity, with the QRS complexes appearing about 1/3 of the time. So therefore, you'll have a P wave, or the atria are humming along between 250 and 350 beats per minute, with the QRS complexes appearing at about 1/3 of that. So all this sawtooth appearance typically is caused by a very irritable atrial focus, and there's multiple reasons for that. Among them would be medication related. So you could have like digitalis could cause this. So excess digitalis toxicity. You could have this related to cardiac distress. I mean, there's several underlying factors, but usually we're talking about very irritable cardiac tissue in the atria. And so atrial flutter, definitely not good. You need to have that checked out. If you observe that new in a patient, you're definitely stopping exercise and referring them on to their caregiver, their primary, usually a cardiologist, whoever it is that's assessing, or the referring physician that's helping out with their electrocardiograms. These other incorrect answer options, paroxysmal atrial tachycardia, while it is atrial tachycardia, so we're talking about tachycardia, the real distinguishing factor here is that you have a 1-to-1 ratio of atrial contractions to QRS complexes. So The atria contract, the ventricles contract, but they go very quickly. So tachycardia, obviously we're talking above 100 beats per minute. I had a patient who showed up once with a 220 beat per minute paroxysmal atrial tachycardia. So it's just a very, very fast heart rate with a 1-to-1 ratio between the atria and the ventricles. Paroxysmal ventricular tachycardia, also known as VTAC, this is an extremely irritable ventricular focus. So a lot of times we're talking about coronary insufficiency or coronary, really the precursor to a heart attack. You have basically some type of occlusion in the coronary arteries, which that prompts an increase in heart rate because you're not getting enough blood to the coronary tissue, and it creates this cascade of, really, it's a positive feedback loop where your heart is starved for oxygen, which causes it to beat faster and harder, which makes it even more starved for oxygen, and eventually just spirals out of control. So this VTAC very often converts into our final incorrect answer option of ventricular fibrillation. So VFib, or ventricular fibrillation, this is a sign of acute cardiac distress. Obviously, this is an acute heart attack that's occurring with effectively no cardiac output. So if you see someone in VFib, they are not long with us unless they're getting emergent care. So if you see VTAC or VFib, you are calling 911. These other answer options, paroxysmal atrial tachycardia and atrial flutter, you're doing a expeditious cardiac referral, but it's not necessarily a 911 call unless, I hate to say it depends, but you'll have a very symptom-based approach. So if their lips are turning blue, they're appearing to have significant unstable angina pectoris, in those cases, obviously, you'll be calling 911. So in the case of isolated electrocardiogram disturbances, you'll be making a symptom-based approach, very symptom-based referrals, totally dependent on what the patient is looking like at the moment. But in isolation atrial flutter, they're probably in some distress. Chances are you're making either a very expeditious referral or a 911 call, again, quite dependent on the symptoms they're presenting with. So back to our correct answer option, atrial flutter. So I've got an image, those of you who are watching the YouTube version of this. Atrial flutter has this sawtooth appearance. And by sawtooth, we're talking about something that has a very uniform appearance. If you look at all the P waves, you'll note that they're extremely uniform, much like the teeth of a saw. Whereas fibrillation, there is not the uniformity. So anything with AFib or VFib, you would not describe that as a sawtooth appearance because they are irregularly shaped, and there's not a uniformity to them. Whereas atrial flutter, that's your classic sawtooth appearance. All right, excellent. Well, with that, we'll bring today to a conclusion. I hope you check out all of the other podcast episodes we've got. And as we conclude, I just want to give you a big thank you. Thank you for what you do. I know that it takes time to study. I know that it takes time to become an excellent PT. You've got a lot of stress and weight on your shoulders as you come to the final year of PT school and as you head into the Npte. Let me tell you, a lot of you who are listening to this podcast have, we'll call it a non-traditional pathway to PT, whether that's coming to PT at a later time in life, whether you've had multiple failed attempts on the Npte, or maybe you just had difficulty through PT school. A lot of you are facing that, and I just want to say thanks for taking the time to spend with me as we go through content to help you absolutely dominate on test day. Those of you who are looking for a real win for getting through the Npte, be sure to check out our VIP program. So the VIPT class, this is where I take my VIPTs. I take you through the content. We go through week by week, all the content. Each system, we spend tons and tons of time on practice questions so that you are not tricked on test day. So not only do you have the strategies to answer the questions, but you also have the content knowledge to, I like to call it X-ray vision. You can see through what the question is asking before you even get to the last line. You're like, oh, clearly this is a question about EKGs and whether or not I can identify a sawtooth pattern. Like you can see right through it to know that you are looking for atrial flutter. And so then when you look at the answer options, you immediately hone in on the correct answer. And so that's what we try to do as a part of the VIP program. We spend time dissecting questions, giving you strategies, plus just giving you that accountability and study plan to make sure that you absolutely dominate on test day. So be sure to check it out over at ptfinalexam.com. In the meantime, stay safe out there. Will Crane fist pumps all around, and I'll catch you all in the next episode. Take care, everyone. Have a great day. Keep your grin on your chin. Talk to you soon.